What medications are recommended in stroke guidelines for secondary prevention? When it comes to preventing another stroke after a first one or a transient ischemic attack, or TIA, the right medications can make a big difference. The goal of secondary prevention is to reduce the risk of future strokes and other heart-related events. Current guidelines suggest a mix of medications tailored to the type of stroke and individual risk factors. Let's break down the main classes of medications recommended. First up are antiplatelet agents. These are crucial for patients who have had a non-cardioembolic ischemic stroke or TIA. Common options include aspirin, clopidogrel, or a combination of aspirin with dipyridamole. Typically, aspirin is given at doses ranging from 75 to 150 milligrams daily. This helps balance effectiveness with the risk of bleeding. For those who have had a minor stroke or TIA, a short course of dual antiplatelet therapy, like aspirin plus clopidogrel, is recommended for up to 21 days to lower the risk of early recurrence. After that, switching to a single agent is usually advised, as long-term dual therapy can increase bleeding risks. For patients with atrial fibrillation, anticoagulants are preferred over antiplatelet medications. These help prevent strokes caused by blood clots. Direct oral anticoagulants or warfarin are commonly used in these cases. Next, we have statins, which are used for lowering cholesterol. High-intensity statin therapy, such as atorvastatin at 80 milligrams daily, is recommended for all patients after an ischemic stroke, regardless of their initial cholesterol levels. The aim is to lower low-density lipoprotein cholesterol to below 70 milligrams per deciliter to reduce cardiovascular risks. If cholesterol targets aren't met with statins alone, adding other medications like ezetimibe or a PCSK9 inhibitor might be considered. Blood pressure control is also vital in preventing future strokes. Patients with systolic blood pressure above 140 millimeters of mercury should receive treatment. First-line medications include angiotensin-converting enzyme inhibitors, calcium channel blockers, and diuretics. Blood pressure targets can be adjusted based on individual tolerance and any other health conditions. For patients with diabetes, managing blood sugar levels is key. Generally, a hemoglobin A1 degrees Celsius target of 7% or lower is recommended. In some cases, adding medications like glucagon-like peptide-1 receptor agonists or sodium glucose cotransporter 2 inhibitors to metformin can provide additional cardiovascular benefits. Beyond medications, managing other risk factors is crucial. This includes lifestyle changes like quitting smoking and addressing other health issues. Identifying the cause of the stroke through diagnostic workups can help guide specific medication choices and their intensity. Additionally, vaccinations, such as the influenza vaccine, and minimizing exposure to air pollution can also be part of a comprehensive prevention strategy. In summary, the guidelines for secondary stroke prevention emphasize a combination of antiplatelet or anticoagulant therapy based on the stroke's cause, high-intensity statins, blood pressure management, and personalized diabetes care. These recommendations are backed by extensive clinical research and expert consensus from leading health organizations. Always consult with a healthcare professional to find the best approach for your individual situation.